More than 2 million people every year end up in the hospital after having a bad reaction to their medication. So what are these risky drugs? As Ali Rasmus found out, you may not always know unless you know who to ask.
Read the fine print on your medication.
Side effects include upper respiratory infection, stuffy or runny nose. Dizziness or fainting may occur upon standing.
And you may wonder why you're taking it.
Abnormal thoughts, memory loss, anxiety.
When something goes wrong with a prescription medication and enough people are harmed by it, the FDA puts what's called a black box label on a drug. A simple square around some words of warning. Professor Gary Marchant is an expert on FDA regulation.
The black box ones are the worst of the worst. These are the real serious ones that they really want the doctor to think about before prescribing that drug.
But you'll have a hard time finding the warning. It's not written on the bottle. And it's not anywhere in the package insert.
They'll say serious adverse events. It just won't say black box.
In fact, the only place you can look up a black box label is in this massive book. The Physician's Reference Handbook.
It will go through every potential side effect, every side effect you got.
And unless you're a physician like Dr. David Carfagno, you probably don't have one of these books handy. So that means it's up to your doctor to warn you about the side effects, and it's up to you, the patient, to ask about them.
What is the evidence behind the medication I'm taking? And how common are these side effects?
Even with a black box warning, a drug is still FDA approved, and doctors may still prescribe it. Here's a list of some popular black box drugs.
Talk to your doctor about Celebrex.
Celebrex, a prescription-strength anti-inflammatory, nicknamed super aspirin. Dr. David Carfagno's prescribed it before, but certain patients, he says, should steer clear of this capsule.
It has potential for heart problems.
A study in the New England Journal of Medicine found people taking more than 200 milligrams of Celebrex a day more than doubled their risk of a heart attack. The doctor's orders?
Be wary, be wary of being on it for a long time. It depends on each case, but if you're on it for a simple knee problem and you've been on it for 3 or 4 months and your symptoms haven't gotten any better, you may want to rethink your strategy and diagnosis.
Another prescription med linked to heart trouble is Advair.
Advair is a pulmonary medication that's used in, a little more severe cases of asthma and chronic lung disease.
A study published in the Annals of Internal Medicine found a component in the drug may cause up to 5,000 asthma deaths each year.
Has a side effect of increasing your heart rate. So you can imagine if they take it a little too often, they're going to increase their heart rate.
There is also a black box warning for a type of antibiotic.
Ciprofloxacin.
Cipro for short.
Any patient that potentially is going to be on that antibiotic, I would say to attenuate and decrease their exercise activity.
That's because about 260 people taking the drug over the last decade suffered ruptured tendons. Hundreds more developed tendinitis. Dr. Carfagno says a good question to ask when prescribed Cipro is,
are there any safer, cheaper alternatives that I may be able to use?
Other meds with black box warnings include antidepressants and all attention deficit disorder medication. The FDA considered putting a black box warning on epilepsy medication, but voted not to.
The whole way we look at this are the benefits of the drug greater than the risks.
It's a conversation you probably want to have with your doctor before you pop that pill. Ali Rasmus, Fox 10 News.
Now, we contacted the makers of Celebrex and Advair about their black box medications. Both encourage patients to talk to their doctors about the risks. Pfizer makes Celebrex, and they tell us patients should understand both potential risks and potential benefits of all medications. For prescription medications, this includes a discussion with a healthcare provider who knows each patient's personal health situation, such as other medicines they are taking that may interact or specific aspects of their health profile. Advair is a GlaxoSmithKline product. The company says the information highlighted in the box is important safety information that, when combined with the benefit information, can help a physician and a patient determine if a particular medication is the right medicine for their health needs.